For Richter transformation, I am really excited about the T-cell engagers, so the bispecific antibodies as well as the CAR T-cell therapies. And the reason this is that, number one, they look fantastic in normal, good old non-Hodgkin's lymphoma. And additionally, some of the preliminary data, at least as single agent, they also look pretty good, especially for patients who have had many prior treatments for their Richter's transformation. So there's new data on epcoritamab as a single agent that's been recently published. And there's my data for CAR T-cell therapy and other data that's recapitulated the same results for CAR T-cell therapy. So where do I see this going? I think that T-cell engagers for Richter transformation are going to be an ideal treatment, but I don't think that they should be used alone. We do know that Richter transformation has a highly inflammatory component, and also because of the underlying CLL, leads to T-cell exhaustion. So when I'm using a T-cell engager like epcoritamab or considering CAR T-cell therapy, I will always pair it with a BTK inhibitor because there's really good data to support using BTK inhibitor plus bispecific antibodies, and there's also good data to support BTK inhibitor plus CAR T-cell therapy. So this is my general thought about where the future is headed, and there's actually a clinical trial being run out of the German group as a partnership with a lot of European nations, and that's going to be pirtobrutinib plus epcoritamab versus chemoimmunotherapy with crossover allowed. And so I think that this is probably the future that we are going to see, but I do think combination therapies using T-cell engagers are where we're headed for patients with Richter transformation.